Hello, and welcome to today's Cuyahoga County and Board of Health media briefing. Today, we're joined by County Executive Armin Budish, and from the Board of Health, we have Health Commissioner Terry Allen, Director of Epidemiology, Surveillance, and Informatics, Jana Rush, and Co-Director of Prevention and Wellness, Ramona Brazil. We will begin by hearing from our county leaders and then end with some questions. With that, I will turn it over to Executive Budish.
Thank you, Devin. Hello, everybody. As always, thank you again to Commissioner Terry Allen and his team for all of their selfless dedication to the health and well-being of Cuyahoga County residents. Terry, the last time I saw you at our briefing about a month ago, we were seeing really bad COVID numbers across the county. Omicron was spreading with a vengeance, with hundreds of new COVID positive cases every day. Now things are looking brighter. Our positive cases have gone way down. I mean, it's really astounding. On December 27th, the Board of Health reported just over 3,000 new COVID cases. On February 12th, just this past Saturday, the number of new COVID cases was just 28. That's really great news. I know that Terry will talk more about what this actually means, but Cuyahoga County is definitely moving in the right direction. While this is something to celebrate, we can't forget that some people are still getting sick and some are still dying. And there are a lot of residents still struggling from the effects brought on by the pandemic. There are still people out there that are out of jobs, still people struggling to pay their bills, still people wondering where they'll get their next meal. And there are lots of people worried about not being able to pay their rent. We've been working hard to help renters avoid eviction. The county's spent over $25 million for emergency rental assistance to provide roughly 3,600 households with rental support to keep people in their homes in the heat of the pandemic. And we're preparing to spend another $26 million in emergency rental assistance. The county issued a request for proposals for the administration of our emergency rental assistance program, as well as other supportive services to those people who are impacted. We're submitting recommendations for awards to County Council based on the responses we received. And I'd like to lay out for you where we hope this money will go. $9.2 million would go to CHN Housing Partners, which has been administering our countywide emergency rental assistance program. $1 million would go to the Legal Aid Society of Cleveland to solve legal problems for residents who are facing financial hardships. $100,000 would be provided to support survivors of domestic abuse or human trafficking and to help people with disabilities or older adults with getting housing. An additional $100,000 would be provided to the Famicos Foundation to work with households to create an action plan and budget to stabilize their finances and housing. $150,000 in grants would be given to Frontline Services to provide mediation services between landlords and tenants, again with the aim of preventing eviction. Finally, an additional $150,000 would go to Front Steps to provide housing stability case management services like housing counseling and legal services related to eviction. We're partnering with a lot of community organizations to make sure our resources are spread as far as possible to reach the residents that need it the most. Now, I'd like to shift gears and tell you about a new report the county's releasing today. The county's releasing its second Sustainable Cuyahoga Toolkit, which is filled to the brim with recommended best practices for communities in Cuyahoga County that are looking to increase their sustainability efforts. We put the first one out in 2016, and as you can imagine, a lot's changed since then. For example, we put out a climate change action plan. We created the Brooklyn Landfill Solar Farm, and we put solar panels on the roofs of multiple county buildings. We launched a scooter share program. You see people riding around on the scooters all through town. And we planted thousands of trees through our grant program. Over 40 local experts were interviewed and provided recommendations for the toolkit, which is broken down into sections like air quality, energy, land use, and transportation. This toolkit can help people, communities, and businesses no matter where they are in their sustainability journey. If you're interested, you can find the full toolkit on the Sustainability Department's website at cuyahogacounty.us/sustainability. I look forward to seeing the many green improvements that you can all make over the next few years. Now, before I turn it over to Terry, one more thing I'd just like to say, how excited I am to welcome to Cuyahoga County the nearly 100,000 people that are expected to come into town for the NBA All-Star Weekend, and I have my prop here for it. This is an exciting time for Cleveland. We're going to be on the center court for one of the biggest sporting events of the year. We get to show the country all the great things we have to offer, the amazing restaurants, great shopping, and bustling nightlife. But as a visitor, it can be hard to know where to go. That's why many people turn to social media to see the places that people are talking about. We want to help our small businesses get some of the visitors in their doors. Residents and business owners can submit their must-visit places across the county as part of what we've called All-Star Business Week. You can connect to our more than 50,000 social media followers and tell visitors to the region why they should go to a particular restaurant, store, or business. We've already received almost 100 responses in just a couple days, and we've been posting this week the places that you've recommended. It's not too late to post a small business. Just go to cuyahogacounty.us, click on All-Star Business Week, and fill out the very simple form. Encourage everyone to follow us on social media at Cuyahoga County and share your business posts for visitors to see. Together, we can show everyone why Cleveland and Cuyahoga County are the places to be, and will help our small businesses at the same time. Don't worry, I'm not playing in the game. Thanks, and I'll turn it over to Terry.
Thank you, Armin, for the wonderful prop there. I'll start to mention that we are doing our part to also support the All-Star Weekend, and our co-director of Prevention and Wellness, Ramona Brazil, will talk a bit about what we're doing together with the City of Cleveland Department of Public Health to promote opportunities for people to be healthy and to be safe. And so hear more about that soon. I want to thank you as always, Armin, for your support for our work at the board. It's been going 2 years now. You've been the stalwart supporter of everything we've done from the very beginning, and an honorary master's in public health degree we will bestow upon you for all you've done on behalf of the community in support of our work. I did want to say a word about housing and health. Certainly, we know that stable and healthy housing are inextricably linked to health, and opportunities for people to, independent of the funding source that they may have for that housing, whether it may be a housing voucher from a program, that they should have the right to have fair access to housing. We think that's a critical right. Also, it's a critical component for health stability. If you have a house and you have a stable home, it can allow you then to work, and it can support your family, not just a roof over your head. It provides a number of compounding advantages. So it's a wonderful commitment of resources to the community. So thank you for that. So we'll move on to COVID, and I'm here with our Director of Epidemiology, Surveillance, and Informatics, Jana Rush, as well as I mentioned, our Co-Director of Prevention and Wellness, Ramona Brazil. And we'll talk to you a little bit today about some good news and some trends and where we stand. So lots of positive news today on our case numbers and positivity rates related to COVID-19. All of our indicators, as the executive has noted, have been trending down over the last few weeks. Our case rate is now at about 70 per 100,000 per CDC, and our positivity rate is at 8.7%. And that represents a decrease in our status from high transmission, now moving to substantial transmission per CDC guidance. And this is, of course, wonderful progress. I remember looking at the data that Executive Budish mentioned. If we look back to really at the turn of the year, January 1, Cuyahoga County had the highest case rate in the state of Ohio for COVID-19 that represented both the Delta and Omicron convergence. By January 24th, we had the lowest case rate in the state. And around us, communities continue to drop as well. So we've come a long way, and what a difference a month makes. Vaccination rates have unfortunately also slowed even in this downturn, which has been a statewide trend. And this, of course, is very concerning, given that the data is very clear about the value of vaccination. We continue to hear and look at the data from the state health department, what's been reporting that since the start of 2021, about 95% of hospitalizations and 95% of fatalities have been associated with people that are unvaccinated. So remember, a vaccination will help to keep you out of the hospital and help to prevent you from dying. That's always been the goal here, and it continues to be true after many, many vaccinations across the world. The number of deaths during the Omicron surge in Cuyahoga County are only eclipsed by the number of deaths that we saw last winter. So even though we know Omicron now is milder, just the sheer number of people that were exposed has resulted in a lot of deaths, a lot of loss, lots of heartache. So if we think about where we stand with vaccination to date, about 62% of our residents have been fully vaccinated according to CDC's definition. That means that they've had 2 doses of mRNA vaccine like Pfizer or Moderna, or a single dose of J&J. In terms of vaccine equity, 42% of our African-American population and 57% of our Hispanic Latinx population have been fully vaccinated. And we continue to work to provide community clinics in churches and libraries, in community centers, so that people can have access to the vaccine. The Ohio Department of Health is also reporting that to date, only 25% of children aged 5 to 11 are fully vaccinated, and 53% of kids aged 12 to 17 are fully vaccinated. So we need to continue to take the opportunity during this downturn, and we strongly encourage parents to get eligible kids vaccinated to protect against another potential surge. Vaccinations continue to be readily available just about everywhere at health departments, pharmacies, at outpatient clinics, and community health centers. You wouldn't have a hard time finding a vaccine. You could probably call today and walk in and get it. Vaccination and boosting have always been our way out of this pandemic, and they also bolster our protection against new variants that may emerge. Of course, the location, dates, and times of our clinics are available at our website, as always, at www.ccbh.net, and you'll hear more about upcoming vaccination events from Director Brazil soon. So you can also check out our community clinics on our website, as I mentioned, and you can also go to gettheshot.coronavirus.ohio.gov or call 211 to get connected to an opportunity to get vaccinated. Booster doses for Pfizer, Moderna, and J&J continue to be widely available as well. And to date, about 55% of the fully vaccinated population in the county have received a booster dose, which is the best way to protect against severe illness from Omicron. And of course, the best way to protect against severe illness from COVID-19 overall as well. Please stay up to date on your vaccinations, as we know that boosters substantially raise your level of protection against hospitalization and fatalities, which has always been the name of the game. This means that you can get a booster dose at least 2 months after receiving your J&J vaccination, or at least 5 months after receiving your Pfizer Moderna vaccination. So transitioning to flu, we do have more good news on the flu front, as flu activity still remains low, and the predominant strain circulating this flu season has been associated with increased levels of hospitalizations, and so we're very glad that it's low. Flu has always made good public sense to get a flu vaccine. It's always been good public health sense, as it can prevent complications such as pneumonia and ultimately save lives, just like the COVID-19 vaccine. We hear people say the flu and COVID are the same in terms of risk and health impact. Let's look at some comparison data which shows that they are not the same. We average on a given year about 22 flu deaths per year in Cuyahoga County. Compare this to COVID-19, where we have seen over 3,400 COVID-19 fatalities in the county since the start of the pandemic last year. Since March of 2020, about 180 people have been hospitalized for flu. During that same period, there have been over 7,350 COVID-19 hospitalizations. Clearly, COVID-19 and flu are not equal. Please take the time during this downturn during this downturn to get your flu shot and your COVID-19 vaccine and your boosters for the highest level of protection. Any hospitalization or fatality we can't prevent by vaccinating against these viruses is a good thing. On the testing front, a reminder that the federal government has launched a website to sign up for free COVID-19 tests, where people can order a maximum of 4 tests and have them shipped directly to their households, and I'm sure many people have done so already. The website is covidtests.org. That's covidtests.org. You can also get up to 8 over-the-counter at-home tests per month, which must be fully reimbursed by your insurance company with no deductibles or cost sharing. Additionally, test kits are covered if they're part of clinical assessment by a healthcare provider. That means you get your 8 free tests per month plus whatever number of tests the doctor asks you to take. Test kits are more widely available now, and as we receive shipments, we provide them to safety forces, congregate sites, and a range of other vulnerable populations in the community, as well as at our vaccination sites. And the state continues to prioritize schools for test kits so kids can stay in school and learn. Hospitals are reporting that their trends continue to move in the right direction, which is also a good thing, and certainly these folks need a big break. Many locations have resumed elective procedures that have been canceled during the Omicron surge. Now, we also know that not just test kits, but that you can access masks. The federal government is making them widely available, over 400 million free N95 masks to all Americans from the Strategic National Stockpile. And you can go to just about any department store or pharmacy and they'll give you a few free N95 masks. So please take an opportunity to grab those. And remember that Omicron has caused significant increase in hospitalizations among our kids, and many remain vulnerable. So consequently, we encourage schools to continue to require universal masking at this time for all students and staff for the health of their population while we're still seeing cases of Omicron occur. CDC provides guidance on masking relative to case rates and positivity rates in the community. And I'd like to close by discussing this community decision-making tool with all of you. And I'd ask Jonathan if he could please pull up the tool. And so you'll see this is called a county check tool provided by CDC, so we can understand issues around rates of transmission, we can understand positivity rates, and make decisions about how to best protect ourselves relative to masking. So if we go down and we look at a grid, you'll see a color grid here. And this grid shows the different levels of transmission and also shows data on case rates per 100,000, as well as the positivity rates from testing over the last week. So if we look at high transmission, that's for case rates over 100 cases per 100,000 and with a positivity rate of over 10% or higher. And so it's important that we consider both of these indicators, not just cases, but also positivity rates. If we look at the orange level, you'll see substantial transmission, and that's between 50 and 99 cases and between 8 and 9.99% positivity. That's substantial transmission, and that is where Cuyahoga County is right now. You also see the next level is yellow, and that's moderate transmission. That's between 10 and 49, and with with a positivity rate of between 5% and just under 8%. And finally, where we all want to be again someday here is low transmission, where we're really seeing basically between 0 and 9 or so cases reported per 100,000, and a testing positivity of 0 to just under 5%. So bearing in mind that we're looking at case rates per 100,000 and positivity rates to make decisions on masks, the CDC provides some guidance for us. If we move down the page, Jonathan, we can show folks just how to make decisions here. So you can see there with that powder blue line, these are county levels of transmission with guidance. So if you're higher substantial transmission, and I'll remind folks we are in substantial transmission, the recommendation for CDC is that everyone should wear a mask in public and indoor settings. When we move to moderate or low transmission levels, CDC recommends unvaccinated people to wear a mask in public or indoor settings. And so I would say that unvaccinated, we also want to make sure that people are boosted to have that protection. We know that the boosters can substantially raise your risk, substantially raise your level of protection. So being vaccinated and boosted is an important consideration, particularly we are hearing that the booster efficacy can wane after about 4 months. So we want people to hang on a little bit longer. Jonathan, thank you for that graphic. We want people to hang on a bit longer here and know that we've still seen people suffering from COVID-19 in many ways and the downstream effects that the executive is trying to address with the funding sources that he's brought forward. And so with that, I'd like to hand things over to Director Rush to provide an in-depth look at the data and where we're headed. Thank you.
All right. Okay, good afternoon. We will pull up our CCBH data dashboard in a moment here. Okay, so just to give an overview of where we are overall year to date. So we've had nearly 185,000 COVID-19 cases reported. That includes confirmed as well as probable, as we're going into the third year of the pandemic. Year to date, we've had nearly 7,500 hospitalizations reported. And in the county overall, we've had about 3,400 deaths reported overall in the county. So that's where we are year to date. In relation to cases, we're currently averaging, as was stated by Commissioner Allen, all of our data is trending in the right direction. So currently we are seeing about 100 cases per day being reported. If we go to the epi curve chart on the dashboard. Okay, so here you'll see the chart of all the cases that have been reported by illness onset date. And so what you can see in the chart as what we've been discussing when we had the large surge due to Omicron cases, you can see we had highs of over 3,000 cases reported in a single day. And now we're down to the average of 100. And if we 100 per day. But if you also look back on the chart, if you look at February of 2021, we are lower than where we were in comparison to last year. So last year we were averaging about 200 cases per day. So we're at half of that of where we were from a year ago. So that gives you an indication that we're continuing to go in the right direction. We're in a better position than where we were when the other surge was happening in 2020 and 2021. So we can go back to the main chart. And so if you go to the death curve, and as I stated, we have currently had over 3,400 deaths reported overall in the county. And again, this shows the data from our vital statistics, which shows deaths by the date that the death actually occurred. And so as you can see back in 2020 going into 2021, you see the bars that are really climbing where we're showing upwards of 100 or more deaths that were reported in a single week. And so now as you get to the end of the curve where you see the graph bars that are lighter shade of gray, that means we had less deaths reported in that particular week. Currently, we're at about 38 per week on average, but we have dropped off this past week where we only had about 4 reported during the week. So now we're starting to see the deaths decline basically to catch up with the decline in cases. And that's just due to the lag time from when a person gets hospitalized and then the case results in a death. And that's usually about 4 to 6 weeks. And so now that we're about 4 weeks out of the surge, we will now start to see deaths catch up to what we're seeing in our trend in cases. And so you'll see that at the very end of the trend line through February 5th, where we had a much lower number of deaths reported over this past week. So we can go back to the main graph. Okay, and so now we can go into our our testing data. So the last tab at the bottom. So this is our trend line to show the number of tests that have resulted in a positive result, and we're looking at the trend line here. So the blue line shows you the average, the moving average of cases that have resulted in a positive test, and the orange line shows the number of tests that have actually been conducted. So as you can see, we're trending downward again. Our average is about 4.5% to 8.5% of positivity rate that we're seeing. And as you can see during the surge, we were really high, upwards of more than 25% positivity rate. We also see that the number of people that are seeking testing is also declining. So it's going in pretty much a sharp decline after that initial surge back in December. So less people are getting tested, but as you can see, there's still a correlation between the drop that's happening with the positivity rate in relation to the number of people that are getting tests. So again, we can know that there's an indication that the positivity rate is truly dropping, given the steep drop off, even though slightly fewer tests are being ran each week to week. So we'll continue to monitor that trend going forward as well. So we can go back to the main graph. Okay, and so if you scroll down to our vaccination data graph at the bottom of the page. So here's the data on our vaccination status. As Commissioner Allen had stated, we haven't had as much movement over the past several weeks as far as the vaccine completion rates for our county. And so currently we're at about almost 66% of our population is fully vaccinated. And as you can see, the green bars actually show those that received that additional dose. So the orange line shows those that have completed vaccination, and green line shows those that have received the booster dose. And so we're currently at about 33% of the population receiving the booster dose. So we're going to continue to work on trying to increase those rates among the population. We're also on pace with what we're seeing with the U.S. So overall in the U.S., there's about a 60% completed vaccination rate among the total population. So we're slightly above that. So we're in alignment with what we're seeing nationally as well as far as vaccination rates. And then we continue to monitor our activity in our school settings as well as our long-term care settings. And so that data is located on the state's website. So we continue to monitor any kind of cluster activity that is going on within those settings as well. And our flu activity also remains low. So we've had about 18 hospitalizations related to flu activity. And so we've had no flu deaths reported this season, which is also encouraging. So we'll continue to monitor that data as well on our flu activity. So I think that's everything that I needed to cover. And so I will turn it over to our Director for Prevention and Wellness, Ramona Brazil, to talk about our vaccination efforts.
Hi, everybody. I'm just reflecting on the fact that it's been 2 years since this all began. And about sometime in February 2 years ago, we were talking about travel monitoring and looking at travelers and monitoring their temperatures and things. And so we're just a few weeks away from the very first date of our cases. And so it's really difficult to kind of even unpack what's happened in these last couple of years. We know that we're in a much better place as a community with overall COVID infection rates, but we cannot undervalue the impact that COVID has had on individuals. So of course I'm a nurse. So a lot of times the numbers are very important, but we don't want to forget about people. I remember the first few months of the pandemic when I got the first phone call from someone who was still experiencing debilitating effects from COVID-19 3 months after she was initially infected. And her question was simple: when will I feel better? And what we know today is that about 1 in 3 people who are infected still have effects from COVID that continue or return 4 weeks later after they were initially infected. And it can last for months after that. And so it can impact people who've been severely ill, as well as those who were never hospitalized and who were considered mildly ill. And symptoms can vary greatly, but most commonly include fatigue, shortness of breath, chest pain, loss of smell, and brain fog. And unfortunately, my answer to her at that time was, I don't know. Today, our medical centers, and we have some locally, have created post-COVID recovery services to help people, and they provide interdisciplinary services based on the person's needs. So as we move away from this current height, and we may see additional cases from time to time, and we're not worrying as much about acute infections. Let's not forget about those who have been changed and still deal with COVID, having had it. So if you have had COVID before and you're still dealing with the effects about a month later, please do talk to your medical provider about getting help. We don't want you to think that people have forgotten about you. I do want to talk really quickly about pregnancy and COVID, because I would like to encourage those who are pregnant or considering pregnancy to get vaccinated. It's vitally important to get vaccinated against COVID if you are pregnant. COVID has been associated with an increase in preterm birth and stillbirth. Some people may think that vaccinating should be avoided during pregnancy, but just like other diseases such as chickenpox or flu or whooping cough, pregnancy is an important time to be up to date on vaccinations. Vaccines given during pregnancy are safe, and they help protect the pregnant person and the baby. According to the CDC data, as of yesterday, 274 pregnant women have died from COVID in the United States since January 2020. Antibodies travel from the mother to the baby, and this helps to protect the baby for about 6 months after delivery. And a study showed that babies who were hospitalized, up to the sickest babies, 88% who were in the ICU had mothers who were not vaccinated against COVID either before or during pregnancy. So all major medical organizations, which doctors, of course, and hospitals turn to for guidance, recommend COVID-19 vaccination during pregnancy. So we do want to encourage, if you are pregnant or thinking of getting pregnant, to make sure that you are either vaccinated or up to date with boosters. As I already mentioned with the CDC, this recommends children 5 years old and older are vaccinated against COVID, but they do remain amongst the lowest percentage of those vaccinated in our county. The vaccines are also safe for children, and we encourage parents to talk with their healthcare provider if they still have concerns about vaccination. We are awaiting approval of vaccinations for those who are 6 months old to 4 years old of age. And we know that we also have some anxious parents who are also awaiting that approval. The best protection for young children who cannot get vaccinated yet is to create a ring of protection around them. And this is commonly what we talk about with other types of vaccines like whooping cough. So the people who are closest and spend time with children regularly should be vaccinated, and that helps to minimize their risk until they're able to be vaccinated. Lastly, many opportunities do continue to be available for vaccination in our community. The Board of Health will be partnering with the City of Cleveland, the Cleveland Department of Public Health, and the National Panhellenic Council to provide vaccinations during this All-Star Week at Tower City in the Sunlight Concourse for those 5 years and older on February 18th, this Friday, from 1 to 5 p.m. People can walk in to get vaccinated. And giveaways are available, first come, first serve, that are being provided by the CABS and the NBA. And with that, I will turn it back over to Commissioner Allen for questions.
Thank you all very much for your remarks. We now have a few minutes for some questions. Please state your name and media organization when asking a question, and remember to stay muted when not speaking. So we can take a question, please. Going once.
Hello, can you hear me?
Yes, thank you.
Hi, this is Caitlin with Cleveland.com. My question is for Executive Budish. In a recent committee meeting, County Council voted down your proposed mandatory testing policy for unvaccinated county employees. Do you still think that a testing mandate is necessary given our current COVID numbers? And are you planning to reintroduce it with changes? Thank you.
Thanks for that question. The answer is I still think it's necessary. COVID hasn't gone away, and our employees have told us they're concerned. They're still concerned that somebody comes in, sits down next to them, and if they have COVID, it can spread very easily. Yes, I do think it's still important. Also, we're a government agency that serves the public, and members of the public are always coming into our buildings, and we want to keep them safe. It's important that we do everything we can to make sure that our employees are safe and protected and protect others. As far as what else we might do, that's still an open question. We'll talk to council, but they did vote it down, and at this point, there's nothing planned.
Thank you. Any additional questions? All right. Well, thank you all very much. That concludes this week's briefing. Thanks so much for joining us, and we will see you in a few weeks. Have a great day.
Thanks, everybody.